Hello, Ghana, and welcome to Healthline, proudly brought to you by Vodafone. As always, your doctors are here to enlighten you on all your health needs. Feel free to send in your questions. Before then, doctors.
Hi, I'm Papani.
Lorraine.
Hello, I'm Bright.
And I'm Ruth. Hypertension, what is termed a silent killer, is a medical condition that is skyrocketing in Ghana. Today, we direct our discussion towards this ailment and provide you with everything you need to know about the condition.
All right, this is an SMS sent by Kwame. He says, I was stung by a scorpion recently and I went to the hospital. I was told my BP was high and I went home. I went back again and it was still high. Could this be from the scorpion?
What could be the problem with your blood pressure is that probably on the first time the scorpion bit you and you went to the hospital, your blood pressure may have been high because of the fright. But then on a second check again, with your blood pressure still remaining high could actually mean that you do have hypertension, or the blood pressure was still high way before the scorpion even bit you. So it's to say that probably the scorpion actually helped you in that they found that you had hypertension. Hypertension is actually a silent disease. You could actually have it for so many years, and it could actually be very high, and you would not know that you have it, okay? And you'd think that you'd probably experience some signs or symptoms of it. In most cases, you don't. In very few cases, you have some few headaches, some palpitations. In other words, your heart is beating, you get tired easily, but these are all non-specific, okay? There are some things that you actually have to consider about yourself that could probably let you know that you may be at risk of hypertension. For instance, if you're somebody who's elderly, quite old, or perhaps somebody in your family has had hypertension before, you could also be at risk of having it. And the fact that you're a male puts you at risk already. They have to look into your lifestyle. Are you obese? Do you exercise? Do you take in alcohol? Do you smoke? Do you live a stressful lifestyle? Okay, these are all factors that could lead to the fact that your blood pressure may have been high way before the scorpion bit you. And I'd say that you are quite lucky you actually have been found to have hypertension without probably living your life without knowing it. Because there's some major complications of hypertension. A heart attack, it could result in your heart failing. You could also have a stroke, and these things are known to be very, very fatal. So I think on the flip side, you should actually thank the scorpion for this.
So we move on to our next question, and this is from Amadou from Wa, and Amadou is saying, Doctor, if you are taking your medicine all right, and yet your blood pressure is not at all that normal, like 120/80, what will you do? And again, please, what kind of exercise can I do?
All right, Amadou, so in your case, you've been diagnosed with hypertension and you want to get your blood pressure back to normal. So then you would ask, what exactly is the normal blood pressure? Well, like you said, 120/80 is what we all aspire to have. Now, for most people, you want it within that average of 120/80. We say you have hypertension if your blood pressure is 140/90 or above. Now, we give you these medications to try and bring your pressure down, and then we tell you about modifying your lifestyle, eating the right kinds of diet, just making sure that you still maintain your blood pressure. If your BP is not coming down still after taking all of these, you should go back and see your doctor. So that's the first thing you should do. Tell him that, Doc, look, my BP is not coming down. I'm doing all the things you told me, but it seems like the pressure is not coming down. It could be that the medication we've given you is not enough to help bring down your blood pressure. He'll ask you a couple of questions, and then he may change the medications or increase the dose or add one more medication to it. I know a lot of people tend to get frustrated. Oh, more medicines, and look, it's for your own good. The thing is that you must never at any point in time try to stop taking the medications because your BP just gets worse when you do that.
Now, one thing we try not to do is to crash your blood pressure too quickly.
Yeah.
The danger is that it means that the pressure suddenly drops and is not enough to supply blood to all the essential organs like your brain, your kidney, etc. So we try and bring it down gradually. So if we check it again, and let's say we are around 140/90, even though it is not 120/80 right now, it's better that we reduce it gradually than just drop to 120/80 as you're aspiring to be.
If you have hypertension and you want to indulge in any kind of exercise, it's always good to talk to your doctor. They'll check your heart to see how much exercise you can tolerate. You may not be able to do exercise that may be as strenuous as what an athlete can do, but he may tell you after he's checked your heart out that, okay, I clear you for exercise, but start this way. Start with something that will not strain you out too much. And then as you progress and with monitoring, it can probably clear you for the bigger marathons.
A lot of us actually think you take your blood pressure medication for a fixed period of time and that's it. Hypertensive medications are for life. Do not ever think about getting off your medications. You take them as long as your doctor says, and hopefully you should be able to live a healthy life.
Okay, there's a call on our phone line. Hello?
Hello, my name is Max. My wife had hypertension when she was pregnant. Then it went away. How is this possible?
It happens in a select few people, I must say. Your wife was probably not hypertensive before she got pregnant. But somewhere along the line, some things may have happened that may have sent her to the hospital and she may have been checked and told she was hypertensive. And there's a condition we call pregnancy-induced hypertension. It means that it's a hypertension, that's high blood pressure state, that only pregnant women get. So by virtue of the fact that they are pregnant, they have that condition. Consequently, when the pregnancy goes away, so does the hypertension. It also goes away. It can be a very, very deadly condition. And usually it will present with a headache around 20 weeks and above of pregnancy. You realize that suddenly you're having these splitting headaches that just won't go away. And then your feet start getting swollen. Those are usually the first two warning signs that you get. And at that point, you could go to a hospital. If you don't do that, you may start experiencing even further deterioration. Your vision gets blurred, you may even pass out, you may have a seizure, you can lose your baby, you can have massive bleeding. There could be so much that could go wrong. And this is what we call preeclampsia. While you're pregnant with that blood pressure, they give you medications, which you're supposed to strictly adhere to. Sometimes, even after you deliver, for the first few weeks, up to about 6 weeks, your pressure still may be a little high, not yet settled. You are still expected to take your medications then. And then after the 6 weeks, most likely it would have resolved by then. And then after that, you could stop taking your medication if your doctor clears you. But subsequently, you're still expected to come for checkups and follow-ups. We have to ensure that it was just a pregnancy-induced hypertension and not something you had before you got pregnant.
Today on Kids Corner, we're actually talking about childhood obesity. Basically, what happens when children become overweight and they can't manage their weight well. You always see in most of the hospitals, parents lining up, getting their children weighed. And there's this little booklet that they have. And then they mark something. And then they look at the height and then they mark it. And when you look into the book, you realize there are 2 lines. And they mark an X either above the 2 lines, below the 2 lines, or very much within the 2 lines. The thing is that we're hoping that we can get the weight and the height of the child to be within those 2 lines. So if your weight or height is below the first line, then that means your weight is actually lower than 5% of most of the children at that age of the child. If it is slightly higher than the upper line, then that means your weight or your height is actually greater than 95% of children within your age. Usually, when your weight or your height is actually checked and it actually goes above that, and then we do a small calculation, we can actually determine whether your child is actually obese or not.
The dangerous thing about obesity is that if your child is obese, maybe you might think, oh, they're fine now. I mean, he's a kid, she's a kid. Let her be, let her eat whatever she wants. But then these are what we call precursors to dangers ahead. If your child is overweight or obese, your child is at risk of having diabetes in future, is at risk of having high cholesterol levels in future. Your child may also have hypertension in the future.
Now, you'd want to know what happened that these children actually become this obese. Some actually are fed so many unwholesome diets. You know, they're giving them the toffees, the sweets, giving them the fast foods, and all these things are not good. They'll just pile up the child's weight. A lot of them also do not exercise. I mean, they just sit in a car, get to school, sit down. Some schools actually don't get them to play much. And they come back home, they're just in the house, continue with their game, PlayStation or something, constantly. And that's it. It could also be a family trait in that the parents may also be obese. So I think it's very important for family members and parents especially to make sure that their children eat healthy, exercise, and do not put on that weight, which would not be good for their health.
And sometimes I realize the routine now is that most parents are just too busy to know what their children are eating. They'll give money to the driver or the nanny that, or pick Kofi up from school, and then on your way, get him some food. Either give specific instructions that cook this for this child and feed him this, or you make sure that you are the one that actually goes to buy the food for the child. Because if you leave it to the children, they'll buy sweets, they'll buy toffees, they'll buy chocolates, they'll buy all the things that they don't need. And you would not know, because by the time you come home, they'll be brushed up and in bed. All you see is things begin to happen.
I always hammer on exclusive breastfeeding. If you really try your hardest and stick to breastfeeding your child for 6 months exclusively, after which, of course, you can add your complementary feeds, then you actually significantly reduce the chances that your child will be obese.
Parents, you've heard it all. They say information is power, so you need to look out for your children. Talk to a doctor from the Healthline call center as soon as you experience difficulty with your health. It's medical advice on 255 at 1 peso per minute. Healthline returns right after the break. Papani is standing by on the streets with some practical lessons.
Hi, and welcome to another Street Doctor segment. You know, there's so many ideas and beliefs about management and the origins of convulsion. I'm here to find out today what you would do if you were faced with somebody having a convulsion. What's your name?
Faustina, I'm at home.
Auntie Faustina, what would you do if somebody around you had a convulsion?
As for convulsion, I haven't seen anybody like that before.
So you haven't seen anybody have a convulsion before?
No. I haven't seen anybody like that.
All right, Auntie Faustina, thank you very much.
You're welcome.
Auntie Achobote.
I found Auntie Abraham.
Can when shamukwe, me no ba fiale.
Nani leja ke when shamukwe. Anya po garlic na ka kwale ake eko fon gugona. Ke bo kenye efo echeye. Ka kwa egugona no bo ke ba chini first ni ba afu. O ke fe na ka no awele. Ka awele abajuanle na akpo garlic eko no ke nkuto na akakwale. Ke mi ahu e tomo bo ke mi ke efe ni tomo hwane bo ke mi a garlic eko no ho aba afi ke akaisho no fio ba akutu na sale ka sale bo ke hedo fe ba ba shi
Ofanarado.
go oyo ade.
What's your name?
I'm Dauda Yakubu.
Dauda, tell me what you do if you have somebody having a convulsion around you.
Convulsion, I don't know what convulsion is.
Thank you very much.
Thank you too.
Ofate Achobote.
Beji Margaret Boti.
Kengwen shamukwe minisana fe.
Okay, noni mi un leji kengwen shagbe ke alu onu aso ino. No abafe an keji o fe kese eko ni ehin etilele be o ba rush le kete hospital. Si ile akame ko me ke e bale na ka ameji o. Gbe ke alo money ni efele aka eko le mu fon ni botemi. Bona fe ni mu mo asie mi. Si mi un ni leji I
see. Thank you. Seizures, convulsions, they are not caused by evil spirits. You're not supposed to beat the children. You're not going to get anything out of beating the children or the adults who have these convulsions. What you want to do for somebody who's having a seizure is to clear the area around them so that they don't end up injuring themselves. Do not try to restrain the person because you might end up injuring that person or yourself. Please do not insert anything into the person's mouth. A lot of people always want to put their hands in the patient's mouth or something to prevent them from biting their tongues. Don't put your hands or anything into the patient's mouth. Just leave them be. When they calm down, clean them up and rush them to a hospital. This is all we want from you, and this is all you should want for yourself and for that patient. Leave the rest to the doctor in the hospital. Take care.
Hypertension is a deadly disease that has led to the demise of many. Today, we have in the studio Mr. Quay, who is a stroke survivor and a hypertensive of 10 years to tell you his story. Mr. Quay.
Yeah.
You are welcome.
Thank you.
What are you find Toyota?
Here you are.
Okay, BP Hilayohe. I fear years on.
BP Hilayohe, 10 years, man.
Well, ne a bat if it end you knock a BP Hilayohe.
In here and Dimi. ni ti drugstore she ni ti drugstore na ke anya ha mitwofo ya kolebu yo ba ho the private hospital ni la na ha mitwofo ni ke ba chan ni pa no ke e na ni e na ka yo nda fe ba fito mo nile mi ba fi titri
lile ba chi oda
chi wenda ke ti chi libia en troto fiu si gbila ni te si ba domo gitira ne ke nyem ke mi yen to ma gbe gota mi ke mi yen to ma gbe gota mi ya ke nya no kwa ke no ko fi mi e ke le won ke to fa ko le ba chomi ni ma he ba ko ni ma he yo ni nche wa fe Newton ni ke e fulu han la ke le ayi ni chon le chufa ko ni ke he ni huwa mi ni mo anu
ni chi shi kwon chufa
yo ni e ke le chon le bi ni ma ba ma je ehutu fa chinye manu ni sheje me abe ni be ma sheje me na bo chon
ona bo chon afakete ne kengbe
e o be ni yi shin ka me le po afo me ka mini fio to bos mini fio ni be ni wo so be ke e na twa mi e o ni awo glass mi ro ka ga nko yin ni nko yin na bo chon fa ni na ka yin fe fe to kologo ni na ka be no ko fe mi ni chwa pa ni pa ke ekimia ya asamai jeme ya bot ntikuma
nchaka beno mi ole no ni ya no ya kutwe mi kwa
no ya no kwa ntikuma 1.5 days
okay
they were beni ba na ba jini ke ba sha in here for 2 weeks ni tashin mi denje mi sumoma fe no ko aluma tishima nye nfo so wa npasa gbogbo ni nte oshi
eto obo keshite
ya na tishi oh nna ne nyema tishi nyema fe tomo akeni ne atelemi engine block waste ne fe eche pula ne
obana ye wale feel
bia first animation
in fact ken kwebo na ke you are a testimony wa denje ija ke mempi ni na no ne ona ne fio pe nyo amenye ka na me gbasa ne na me chon mempi at least onyo ke me wie onye o move na ne onyo move ni ji mempi ye village in American na you are a very big example to what audience any or attack minta on no care audience minta no kama you no care me how me advice boy me kokwa ke BP la yo he na abucho fam mini jino ni sanofi
BP jo fan ke BP yo he nya ha bu jo fa sano o bomole no koda BP jo fan le da ne be akwe ya ke da sanima ko
akebo
ke ashibe doctor se komia ke sanima koda ke ashibe di mambupu shike every day sanima ko ekome every day no le nkoda ninkitashi ne point yebi e matabia
minda nwoshi atakwe ene lo yiwa don aka oba ko we ba yue nyoma job ne wabo no na he wale fe bono na nepo no boy trot mo eko no ko hama no boy carpentry eko. On our last season, we met a frail Janet who was confined to a hospital bed. Her one wish was to get well and go back home. Let's have a look at her story and catch up with her a year later.
Ajalo Janet. My age is 13. Nova Clopo Naniva. Matama Dundu Ranido. A barrow cry in
January, when I can a twangua. I took it by Janet Vajedo. Janet Vajedo. Tamino, Papa Sea. Wakaba, I don't put wabi. If I walk with the vactor, Kakava Mochi, Cobaba Mochia.
Eke Janet, a $1 jagomala. A paper dome. A paper dome, Yemique de Koji. Mique Koja, doctor or operation Janet. Operation, I'm never knew Tamikova who Koji.
Janet had her appendix removed in a small hospital. The wound got infected, resulting in an abscess. Her condition got worse, and her bowel burst through her abdominal wall, where feces would then come out.
She felt that she was not fit to live among people because of the feces that was pouring out of her abdomen. And it was quite a distressing situation for her. I came in and I counseled her, I encouraged her. I told her it would be all right with the operation. And it appeared she picked up.
Doctor, what about operation? I seal it.
The following scenes contain images that could disturb sensitive viewers. Viewer discretion is advised. Vodafone learned of Janet's condition and got her the operation that would ultimately save her life. The surgeons removed the damaged part of Janet's bowel. They then needed to sew together the healthy parts of the bowel so that Janet could function normally again. Vodafone would like to thank the staff at the Volta Regional Hospital in Ho for all they have done for Janet and her family. The team returns to Ho to find a much healthier looking Janet.
Operation anavola me honye pala mnesese me pojudo enonya go come ko school ifia me tele mda na nonye nye play da danya ha mi na mi va ona fufu mi pona jujo kemele dolela no vi mi ka bana nyigbo akeke me hayala obeto ga jetetere nyum ta mo pojujo.
Janet is living a normal life. Unlike previously when she has the opening on the tummy, she looks very cheerful. She has put on a lot of weight and she's living a normal life.
Me povo tutelo me bana kemele dolela o ga tiare nyum ake me hayala povo ga jetetere nyum.
I think it has made her stronger. Now I think that she's able to face challenges because now she still has challenges in her home life, but I think that it has given her hope. I think that Janet is a strong child. Under normal circumstances, most children will not be able to endure this. But she has an enduring spirit. I can see that she has a bright future.
Don't believe everything you hear, especially if the source cannot be trusted. Let's talk about myths. So our next question is from Akpene from Somanya, and she says, I remember putting kulu kulu on my breast when I was younger to make them bigger. I have big breasts now. Is this why?
Hey.
Has the kulu kulu worked?
Hey.
What is kulu kulu?
You know, there are these little insects that burrow in the sand, right? And they make this very nice little cup-shaped thing as they keep going around. Yes, those things. So I think the word cup and breast, cup size. I don't know who saw it and who thought about it.
If you used to kulu-kulus, it would be a big cup.
Maybe. We will never know. We will never know. But the whole point is there's no scientific basis for this, okay? There's no chance that you would actually get... I mean, those insects are actually hard to find. It's just a way of trying to tell you, dig well and find it. But if you find it and you put it on your breast, it doesn't have any effect. Indeed, if you're going to have big breasts, you are going to have it. There are these things called genes. There are things that your parents carry. In your case, maybe your mother. And she will give you some of these things, and then it will make you carry some of the traits. So that's why you might end up looking like your mother or somebody else in your family. The thing is, if you have big breasts in your family, the chances are you might also have big breasts. It's not always a given, but it has nothing to do with any insect by any kind of name.
So that goes without saying that if you have small breasts, kulu kulu will not help you.
It will not help you at all.
So put the silicone implants out of business, isn't it?
Nice one.
Very soon they'll be suing the kulu-kulus.
We take the cameras out onto the streets to listen to your health concerns on HealthCam.
I'm Patience Ribeiro, speaking from Kolebu. What causes hepatitis C and how can I prevent it?
You know, it's the first time I've actually heard someone ask about hepatitis C. Most of the time, people are interested about hepatitis B infection, and they can't really be bothered about hepatitis C. Rightly so, because hepatitis B is more common than hepatitis C. Nevertheless, hepatitis C is also around and can be very dangerous. It's usually an infection that affects the liver, and it causes the liver to swell up. And it's caused by a virus we call the hepatitis C virus. Now, this virus is usually transmitted from one person to another through blood contact. So you'd find it very common in people who are IV drug users, people who inject heroin and cocaine and share needles with other people. That also goes without saying that if you should receive a blood transfusion that is contaminated with the virus, you could have hepatitis C. A lot of people who have hepatitis C may never know until it's too late. But the good thing is that a lot of them remain in a chronic state and they don't really get affected too much by the disease. And a few people who have symptoms of the disease, they may feel like they're a little weak, they're tired, they have joint pains, they have fever, they don't feel like eating. Just the very usual feelings that you think you have when you have malaria. At the time they will know that really it's hepatitis C, it would have caused damage to the liver, meaning that they'll be having either liver cancer or liver failure. And at that time, you'd find them having yellowing of the eyes. And if they are light-skinned, you find that their skin also looks a little yellow. And they begin to have all the problems that are associated with a failed liver. So one would want to know, how can I prevent getting hepatitis C? If you listen to what we said earlier on, it's basically getting contaminated with an infected blood. So anything you can do to avoid having that blood in your system. When you go to the salon to do your hair and your weave-ons, you can decide to buy your own needles and carry them along. And then you don't want to share needles with people who could have this condition. Now and again, people who are known to go for tattoos and piercings, you never know who went before you. And we cannot be sure of the degree to which the instruments were sterilized. So that's another way you can also get it. So you want to guard against all of these things.
So you'd want to know, how do I know if I have hepatitis C? It is a simple screening exercise. You can walk into any reputable laboratory, or you could go to the hospital and say you want to know whether or not you have hepatitis C.
The following segment contains material of an adult nature. Viewer discretion is advised.
Havelock quotes, "Sex lies at the root of life, and we can never learn to revere life until we know how to understand sex." Time for sex talk.
All right, we have a SMS. This message actually has no name. The sender writes, "Anytime I speak on phone with a lady, especially my girlfriend, my penis erects, and through that, sperms flow, even though I don't have an orgasm. Please, why?"
A lot of people think that any fluid that comes out of the penis when it's erect is sperms or it's semen. You know, before you actually ejaculate when you have an orgasm, there's a fluid that comes out of the penis. Usually, you find out that that is not like the regular semen. It's usually clear fluid, and it's probably a little slimy. It's what we call the pre-ejaculate, and usually it's for lubrication. So you're excited, and your penis is getting ready for action. So that's your body's way of saying that to prepare you and to help you prepare the lady, let me give you some fluid to lubricate yourself and the lady. So there are certain glands in the male, okay, that produce this liquid that comes out. Eventually, this liquid you see will be part of what comes out as semen when you have an orgasm. But what you see coming out is not likely to have sperms in it. It's usually very harmless fluid, if I want to put it that way.
This pre-ejaculate is usually very important in that where the urine passes causes the pathway to become acidic. And this liquid that is released when you are turned on helps to neutralize the acid. Because if the acid is not neutralized, as soon as the sperms start passing through, the sperms can actually be destroyed because of the acid. So I guess it's a very important fluid. And I think let's assure the guy there's nothing going wrong.
After the break, we dive into our main story.
For years, Emmanuel has had to endure the mockery from people around him. Our team in the field travels to the Volta region to find out more.
Emmanuel Vigo is an 18-year-old boy who suffers from ankylosis of the temporomandibular joint. That is, the jaw is fused to the base of skull, so he can't open the mouth for feeding, even talking, nothing. Because the mouth has been inactive, his jaw is suffered the consequence of not growing, because the jaw grows according to how the movement of the jaw goes. So we have to also try and lengthen the length of the distance so that the face will look more or less normal.
Emmanuel Vigneault, Capper, Kemijira, Ellen, and the camera journalist. There cannot be a Vermagben and Eki. You could run over on Vene, Biadula, in over Sally over them. You can lay coach. Elevator.
Kemijira, and a mellow woman, a vachishi. Ah. Nipo mistake alakalenti. One of the effect of a fienna. Camilla and Mopolenti. Alaba Yan Mopepo. Who Mavak played the Koji woo. Not a piece in a metanaka, a gladina meal. I don't know my choga, she can't bail a money.
No, dear flying a camel for me. Cake Matan, as in Quack with the Vassamol, no, about me. My daughter, one canoe, Tamada, they never know what you done.
A glad Tana. No, me eat the flower. I'm one of you. Well, no, and you can. And one time attend the festival. No, me gonna have a double and me. I'm one of you, and I see film. Yeah, story me haru, no me Kojiana. I'm over Kojiana, one of you. I'm in Pong who dog a curve. I'm one of you, I've been young. Second, Matalumana, come to no, Mundiana, and now I've been like and now I'm not funny. But that's the sorry, I'm doing. We and then me, I'll be will say, which I want me. I'm on a phone. Please, I'll be with family. I know I'm thinking because of naming. I'm on a phone. I know I'll be one of the few.
Emmanuel's brother, Nelson, also feels the effects of his brother's condition.
Nya to ka no jogomala anya on sasa to ka goma jejeka ka eba yale bi abi minya no vikra na bi imranye kuri atamsira meton dalo ne o ala ba ono falu le lino diti to ema ko do na kala na be ga kilometer mi ka pra atiken ga ka kama kata bi meton le na ko mo o ka ka badasina fifie.
I'm dreaming. I'm a Nita, I'm the woman. I'm a woman at the turn. Yeah, no man, I never feel her. I'm the one time. Ubu, I'm trying to feel this school. Teaches you Ubu, and the one time Ubu in Yanako. In the clean in the vineyard school. Shake your Mudina, your Wukojin seller. I want to tell you, yeah, and the aim of your one half winning.
The first day I met him, I developed some kind of, I may say, love to him, and we are close friends. Emmanuel, if you could find out difficult in breathing when you sleep, there's some kind of sound will be coming, and he smell a lot. So I believe strongly that is the reason why some of the friends doesn't want to get close to him, because of the smell, the scent that comes out from the mouth of Emmanuel. And also too, he don't eat hard food like solid foods. If the food is not liquid or soft, you can't take it.
And I'll be in an equity. I'm own one. I'm going to be in TV and wait on. And I've been an Hannah about water. Yeah, then when you were 10 to 1, I've been in a water power. What the time?
Papa, I'm going to be a dollar. Mama grandma played the coju. A gamma back on nursing. The mac play called Galacaju. Mapafu ah. Matuf papa mama wevu ah. Mapapa lenti to how. Family like Camela senior. My bike when I be rock Valentina how. It have mama to him.
No people me can't be yeah avoid slow avoid giving musanosi at your door. Yeah, I don't know dear Agbomo or Vaman and Ma that I need you to know. You cut up a pre a pojila cut up you, but pre Kurukoto kata you yelegi.
Enyeji ekamatare abe apuama ha ma wo gidigidi o ndagbani ha atode la mana eta manle ha manle pa na dolele ba tikro ha nyete ejita magbina meleko ma manle pa lo wa mabubuta.
Time to know preaching every between my school. Yeah, be no turn school young what to Farada. I don't put either be no one have a 20 gamma. Please, no one I am a pretty good clean be Yamma Makaku. Please, not to win that. Only Yamma have with my few $1. Yamma 22 Yamma, how do you feel?
The following scenes contain images that could disturb sensitive viewers. Viewer discretion is advised. Vodafone stepped in to enable Emmanuel to get his life-changing surgery. Vodafone would like to thank the staff at the Ridge Regional Hospital for all they have done for Emmanuel and his family.
Alex's surgery took very long to complete, but finally our objectives were met. We managed to open the mouth as well. We managed to elongate the chin a bit so that the profile will change considerably. I think for someone so many years not opening the mouth, you have to go through some few sections of physiotherapy to get him back on track. We use the laser therapy, which also helps a lot in reducing post-operative pains. So I think in total he'll be okay.
So Emmanuel, Mr. and Mrs. Viku, you're very welcome.
Thank you.
We've all seen this great transformation and we're all so happy, we're all so impressed. But we'd like to hear from your own mouth, how was life before the surgery?
My life is very hard for me. And I can't eat. And I can't go to anywhere, like going to sports. If I'm going, people will start laughing at me. And now I feel better.
How are things? How do you see things now?
Now I'm better. And I feel handsome.
You feel handsome?
Yeah.
That's great. That's good to know. Mr. and Mrs. Viku, I'm sure you've all seen the change in your son. I'm sure you're all so very happy. What would you like to say? You know, Vodafone is so happy about your recovery and the transformation that actually taking place in your life. But then they still want to go an extra mile to continue to support you on the road of recovery. So what they have here is a little gift for you, which I'll present to your father. And it's from Vodafone to say they're still behind you and supporting you on your road to recovery.
Thank you. Thank you very much. I'm very grateful for the industry of Vodafone. I don't even really know that they'll be doing this thing for me. I'm very thankful. I thank them very much.
This is also to just let you know that the swelling that we see on Emmanuel's face will go down. It's as a result of the surgery, and the effects of the surgery are still improving. Undoubtedly, Emmanuel and his family are very grateful to Vodafone, and we're sure that Vodafone will continue doing this great feat in the lives of other people. Sadly, we draw the curtains on this week's episode. Until next week, stay positive, stay gorgeous, and stay alive. Goodbye.
If you have been moved by the stories or issues you've seen on Healthline, you can donate 1 Ghana cedi by texting GIVE to 133. If you want to donate more than 1 Ghana cedi, please dial *133# and follow the prompts. Next week on Healthline, our doctors talk about our favorite topic, sex. In the field, the team meets Samuel, a young man who is battling to walk. We also meet up with Maria Pia from Season 2 and see how she's doing after her encounter with Vodafone.
Vodafone, power to you.